Hi guys, Leah and Bear here. Welcome to our new YouTube channel. You may have followed us across from Instagram and TikTok, but in case you haven't and you've just stumbled across us by chance, this video is going to be a little bit about Bear, how he's recovered from hip dysplasia and what he's up to today. So before I start, let me just say that I am by no means an expert. I'm not a veterinary professional, I'm actually a microbiologist. But what I do have is a first-hand account of raising a puppy with hip dysplasia, and I thought that might be helpful to maybe people who have found themselves in a similar position that I did a year ago. So through this channel, probably spread across a couple of videos, I'll be sharing our experience through it from diagnosis to recovery and pass on what I've learned along the way, because this condition, it affects a lot of dogs, and although it's quite common, I think there's a lot of misinformation out there. So hopefully by sharing my own experience and the referenced information that I've found, then I can shed some light on it for you. So to those who maybe haven't heard of it before, hip dysplasia is a genetic condition that is often passed down from parent to offspring, and it can affect many different breeds, although it is probably most common in the larger breed dogs. It can become a problem at any stage in their life. Some of them will be affected as puppies, whereas others may only have the issues later in their life. The word dysplasia itself means abnormal development, and this causes a laxity or a loosening of the connective tissues that would usually support and hold everything together around the hip. So you'll often hear the hip being referred to as a ball and socket joint, and that actually makes it easier to visualise how they should fit together in a healthy individual. So at the top of the thigh bone, the femur, you have the femoral head, and this is what forms the ball in this scenario, whilst the socket, that's the slot into which it should fit inside the pelvis. That's the acetabulum, and that should be a deep cup shape. So a lot of people think that if a puppy has hip dysplasia that they were born with deformed hips, but that's actually not the case. They're all born with normal hips, but because the genetics make them predisposed to developing it, the physical changes, they take place during the first few months of their life. Because of the loose ligaments and tissues around the hip, they don't have that tight fit in joint, so the contact pressure of running or walking is not spread equally across the whole of the surface of the socket. So the femoral head, the ball, it can actually displace slightly, so it weighs against a smaller surface area rather than the whole surface area, and that small area that it's knocking against, that can also actually fracture. And over time then that will change the shape of the socket from a nice deep cup to more of a shallow saucer, and then of course they no longer fit perfectly together, so it's more like that sort of situation. So what you end up is this, instead of how it should look, this. So to give you a little bit about Bear, we brought him home when he was 10 weeks old, and at that point he was just a seemingly normal, healthy puppy. There really wasn't anything to suggest that there was any health issues there at all. It was just a playful ball of fluff. It was really only a couple of weeks later that we sort of began to question things, because he was very clumsy as a puppy, and we initially put that down to just him growing so quickly, you know, as all large breed puppies do, and we thought maybe he just hadn't learned to control his long legs yet. But then as the weeks went on, there was more to it than that. There was a nagging feeling that something wasn't right. So I'd say probably by about 4 months old, it became clear that there was something else going on. He was unusually tired after playing, like even after short periods he would groan when getting up from lying down, as if it was hard work for him. By around 6 months old, Bear was displaying a lot of the typical signs of hip dysplasia, which I'll probably dedicate a whole video to at some point. But as well as what I've already mentioned, he was also stretching his legs excessively, like all the time when he got up. He had a tendency to bunny hop, which is when the two legs sort of pound together whilst they're running rather than landing independently. And he just had general discomfort after light exercise, which wasn't what you would expect from a young dog. So I actually brought these signs up to a vet once at our vaccination appointment, and they physically felt around his hips for any obvious signs, which they couldn't find. And I was told there's probably nothing to worry about and I should just keep an eye on him. And that's something I was told quite often. I would mention these concerns to my friends and my family, and they would tell me, oh, it's probably nothing, he's probably just tired, he's fine. But then one day I'd taken him to have a play date with one of his friends in the park, and you know, they were having a great time, they were absolutely fine, nothing happened to cause them any injury, they were just playing like puppies do. But then the following morning it was a totally different story. He was really not himself at all. He was really quiet, he was really lethargic. He didn't even get up from his bed to come and greet us, which wasn't like him at all. He was just really stiff in his movement, and he actually had a little bit of a limp on his hind leg, and this is a 6-month-old puppy now, so that's not what you would expect from him at all. So I booked him in for an emergency appointment at a recommended vet who examined him again, and they found nothing obviously wrong. So I explained my previous concerns that I'd had about possible hip problems to it, and I requested an x-ray, which they did, and that is when they confirmed that he did have hip dysplasia. Well, it wasn't even just hip dysplasia, it was severe bilateral hip dysplasia. So in some dogs they'll have the condition, but it'll only affect one of their hip joints, which is quite uncommon. It's usually both of them are affected. But in some situations you'll have one hip that's a lot worse than the other, and the other one might be fine. But in Bear's case, it was equally as severe in both hips. They were really bad. They were actually the worst hips that they said they'd seen in a long time. So yeah, even though we already had suspicions leading up to that, it was quite a hard hitting diagnosis for a 6-month-old puppy. So here's a photo of that x-ray. I'll add a photo of a healthy pair of hips next to it for comparison. So you can see in the healthy pair of hips that you've got a perfect example of how a ball and socket joint should look like. This is a tight fit, whereas in Bear's x-ray they're totally misshaped and it's not a tight fitting joint at all. So we discussed different options at the vets, but ultimately it was decided that a total hip replacement was really the best option for him, to give him a normal life, because there are drugs that you can take to manage the pain, but personally, I mean, that just wasn't an option that I wanted for Bear, because he was only 6 months old at the time and it was already having such a big impact on his life. It was obviously causing him a lot of pain, and it was probably going to get progressively worse, and I didn't want him to just be reliant on medication for the rest of his life if there was something that could be done to totally, you know, remove this problem. And I think for a lot of people, if surgery is an option, that is the best long-term solution for a really severe case of hip dysplasia. So we started looking into specialist vets that could perform the hip replacement, but since Bear was only 6 months old at the time, there really wasn't anything that could be surgically done until he was at least 12 months old. So in the meantime, all we could do was restrict his activity so he didn't overdo it and hurt himself, and try and keep on top of his pain with some medication. So Bear had a prescription of tramadol painkillers, which are pretty strong, for all the months leading up to his first birthday. We also took him to regular hydrotherapy sessions to help build up his muscles, and this was really important because although Bear had okay muscles at the time, we were told that after his operation he would need a lot of crate rest, and obviously he wouldn't be able to exercise, so he was going to lose a lot of his muscle, and that's really key to holding everything together around the implants while everything sort of heals up around them. In May 2019, when he turned 1, he had his first total hip replacement. And although he needed both of his hips doing, we chose to have his left one fixed first because that seemed to be the one he struggled with the most. In the surgery, they totally removed the original ball and socket joint, so the femoral head, the ball, that's cut off, and they insert a metal version of that into the bone, and then they add a new socket into the pelvis, and they're like how they should be, they're proper, perfectly fitting joints. So he stayed at the vet's overnight, but he actually came home the next morning. Usually they'll keep him in a bit longer to monitor them for a few days, but Bear he's not the easiest patient, and we just decided, us and the vets, that he would recover better at home where he felt safe, because it was difficult to get medication down him. Like, we struggle getting medication down him, but he's a family orientated dog, shall we say. He's not great with strangers, especially when he's scared and he's in pain. So at home we had a large crate ready for him that we had lined the sides with a duvet and some pillows. It was literally like a bed, like a human bed. It was really comfortable. And then we also added some dog mattresses to the bottom and blankets, so it was nice and padded. It was fine. You know, he couldn't knock himself on any of the sides and cause himself any injuries. And it was just as well that it was comfy because he spent a lot of time in there. And before anybody comments that it's cruel to keep him in a crate, it was totally necessary. I mean, we were literally told by the vet he had to stay in the crate for weeks, really. I mean, we broke it up, of course, and he had toilet breaks, and we took him out when we could on a non-slip mat surface. But it was really so vital to his recovery that he did stay still and calm, and the crate was really the only way that you could ensure that. So he spent a majority of the first few weeks in that crate. We would take him for toilet walks in the garden, but that was only when he was wearing a harness and a sling around his waist, so we had full control of him, because then if he did try and bolt or he looked like he was going to slip, we could just quickly hoist him up and take any weight off his hips before he could do any damage. For those 2 weeks he had to wear a cone whilst the wound healed, and he really hated that. but between us we all took time off work so that we could stay with him at all times and watch him during the day. So we would either take it off him whilst we were watching him, or make him wear an inflatable one, which was more comfortable and slightly less restrictive. But night time was the main time he had to have it on, because you really couldn't be supervised, and one lick would have introduced an infection, and that could have totally compromised the whole surgery. Like, it could have literally ruined the whole replacement. But thankfully, once he had the stitches out after 2 weeks post-op, he then didn't have to wear the cone anymore. The wound had healed up and he started sleeping so much better at night without it. Also at this point, Bear was totally pain-free in that hip. The replacement had removed it completely, and he was feeling so much better, so much more himself, visibly happier. The first few days after the operation, he was really groggy and not himself, like as you would expect. But you could see as we reached the sort of 7 to 14 day mark, he was so much more comfortable, and that was amazing. It was great to see him so much better after he'd been in so much discomfort, but it also made things a lot more stressful from the recovery side of things, because as far as he was aware, he was fixed. He was like 50% less pain than he'd ever had in his life. So he just couldn't understand why he had to be confined all the time. And we had crate trained him as a puppy. That was something he was used to, but he also had the ability to just leave it as and when he wanted, whereas in that time he had to be literally kept in a crate all the time, and it was for his own good, but how do you tell them that? So for the next few weeks we sort of switched between crate rest and bringing him to sit outside on a mat. We had non-slip mats everywhere. Literally the whole living room was covered in them, because we couldn't risk him slipping on, we have wooden floors, and that would have been a potential hazard for him. And also he had to be kept on a lead literally all the time. If he was out the crate, he had the lead on. He could not be anywhere without the lead. He had to be on a short lead, like all the time. And then after you reach the 6-week post-op mark, the risk of dislocation is a lot lower, so he was able to come off the lead in the house again. And that was a big milestone for him and for us, because keeping him restricted for 6 weeks had been really challenging, especially when he was feeling better every day. So this gave him a little bit more freedom back, so he could roam downstairs freely. He could sleep on the sofa again, which he'd really missed. He still wasn't allowed off the lead at the garden or outside for another 6 weeks after that, because it's only really at 12 weeks post-op that is considered to be solid and fully healed. He was so much happier in himself. Every day you were seeing an improvement in him, and that was just after having one hip done. A few weeks later we booked him in to have his right hip replaced, and we went through the whole process again. At the time it felt like such a long and slow journey, and it was stressful, and it felt never ending at points, as it is basically a full-time job supervising them whilst they recover. But now that we're 1 year on and we're out the other side of it, the difference in him is incredible, and it made it all worthwhile. Physically he can do anything a normal dog can do. He has a full range of movement in his new hips, and they're 100% pain-free. And he's just so strong on them. To see him running around now, you would never have known he'd ever had a problem with his hips. You would never think that the hips he has aren't his. But he doesn't take any medication anymore because he doesn't need it, and his implants will last him a lifetime. They've completely removed the obstacles he used to face when he had dysplastic hips, and they've changed his life. He's definitely making up for lost time now. He runs around like a racehorse, and he jumps like a crazy thing. I don't encourage him to go crazy, but you know, he is definitely able. He can do what he wants to without restriction. At one point we were told that if he wasn't operated on, by the time he was 2 years old he would struggle to even walk. I mean, they actually offered us euthanasia at that point, although it was obviously not an option for us. I mean, just to look back now and see how he was, although it was a long and stressful road to get here, you know, I would 100% do it all again to get him where he is today. It's given him such a new lease of life, and that he has no restrictions now. He will just go on to live a long and healthy life. So that's just a little bit of background about hip dysplasia and Bear's story. If you found this video helpful, what are you doing? If you found this video helpful, please like, comment and subscribe. I'll be adding more videos addressing more questions about Bear's hip dysplasia that have been requested on his Instagram. So if you have anything specific that you want to know about it, let me know, and I'll add it to our next videos.